Hi, it's Sandy, your rec center dietitian, and thank you for joining me. Today, we're going to talk about lifestyle strategies for helping to delay the progression of type 2 diabetes. So, let's go ahead and get started. You guys are probably familiar with most of these, but exercise is a lifestyle strategy that can help in lowering your blood sugar. As you work out, you actually burn your blood sugar, which can help to keep it down and hopefully keep your blood sugars in a more normal range, but also offset the amount of insulin that you may have to take if you have type 2 diabetes. So the key is to be consistent with your exercise. You want to make sure that you are working out regularly. So this means making it a priority and really getting it into your schedule. And the other key factor here is that you want to do exercise that you enjoy, because if you don't enjoy it, you are not going to keep consistent with it. So finding those things that you enjoy are very important. So for basic guidance, we want to see you working out about 150 minutes of moderate to vigorous aerobic activity a week. Um, this can be split up in 30-minute sessions, 5 times a week. You could walk 10 minutes before or after your meals each day to help lower that blood sugar. But the key is to get it in 10-minute segments or greater to really get those benefits in of lowering that blood sugar. And then we also like to see a couple sessions of weights per week. And this is to help maintain bone density, to help keep you strong and able to do those activities of daily living as you age. And you should be doing this unless your doctor has said that it's not a good thing for you to do, or it's contraindicated for you. So, types of exercise. Walking is surely a great one to get in. You just want to make sure you have a supportive pair of shoes to wear. Cycling is another great exercise to get in, and older adults can even do, some HIIT on the cycling where they're getting some high intensity interval training where they're actually bringing the heart rate up and down by maybe doing a minute of harder intensity and then slowing down to a uh, lower pace. And this can help with weight loss. It can help burn that blood sugar. And again, that cycling helps reduce the joint strain, on the knees and the ankles and the hips as well. So a great way for older adults and younger adults to get a good workout in. Swimming, if you have access to a pool, is great for preventing those joint injuries and just much easier on the body. And especially if you are overweight or obese, this can be a great way to get started in an exercise program so that you aren't putting a lot of strain on your joints. Team sports, so anything that you enjoy doing on a team basis can definitely help. And just having that camaraderie with your co-players can help to keep you motivated and continuing to exercise. So whether it's bowling or volleyball or whatever it is you enjoy. Aerobic dance is great. So if you like a Zumba class, we also have a line dancing class here at the rec center that's very popular. So those can be some ideas for getting in some of that exercise. Otherwise, you can turn on YouTube videos and dance as well at home. Weightlifting, that can help build that muscle, and you can do free weights, hand weights, or you can do machine weights. You get a little better control with the machine weights. We have our all of our fitness instructors here that can help you develop a program that is free for either cardio or weights here at the rec center. If you did want to personal train, that would be an additional charge, but that's a great motivator as well. And a lot of people get back into working out by doing some personal training. Resistance training as well. A lot of our classes may use some types of resistance bands, body weight for resistance as well. If you haven't tried our base camp class here at the rec center, that is another great class for helping to make sure that you are continuing to keep strength on both sides of the body, so from side to side, and working on any compensations you may have developed over time with incorrect movement patterns. So base camp is another great class for getting some resistance and body weight training in. Calisthenics, we probably all know a lot of those we learned in gym class when we were younger. Some of those push-ups and other things can be great ways to get some exercise in as well. We also offer Pilates here at the rec center that can really work on that core strength and balance. And yoga, we offer yoga here at the rec center as well, can help with improving sleep and also has some metabolic benefits that might help with blood pressure, lower cholesterol, those type of things. So all these types of exercise or come into the rec center and do some of them can be great for you. And now I want to switch gears a little bit and just talk about sleep hygiene and how important it really is to have that recovery time each day. So they really recommend you get about 7 to 9 hours of sleep each night. And I know a lot of times as you age, or if you have a lot of stress in your life, it is difficult to get that amount of sleep. So I would really encourage you to talk with your doctor if you are not getting enough sleep in the evenings. And certainly there are some strategies we can try. And I talk a lot with groups that I speak with on sleep hygiene or developing a routine before you go to bed. So first of all, you want the room that you're sleeping in to be conducive to sleep. So you want it to be dark, certainly. You want to have dim light before you're going to bed. So you want the melatonin to start kicking up as the lights dim and the darkness comes outside and outdoors. That helps that melatonin to produce in your body, which can help you to fall asleep. You want to, if you can, create a pretty routine sleep schedule. So I usually tell people to think about what time you want to go to bed each night. So say you want to go to bed at 10:30, and then you want to back up your time from there as far as all the activities that you need to do before getting into bed at 10:30. So for example, you would probably want to stop eating at least 2 to 3 hours before you go to bed so that you're not kept up with digestion or acid reflux or something overnight. You would want to figure out what time you want to, brush your teeth, wash your face. If you have kids to get ready for bed, what time you want to give them their baths, read stories, that type of thing. But just developing that routine. It's also very good to turn off those electronics 30 to 60 minutes before going to bed and maybe reading or doing a puzzle or something that's not too strenuous on you, but also relaxes you. And then, also just any activities that might help to unwind you before you go to bed. So say you like to do a little meditation or a little stretching before bedtime. Those can be great activities to enjoy. And then if you can prevent it, don't nap during the day because that nap is going to discourage you from sleeping in the evening. So those are some great strategies for developing that sleep hygiene routine. And then I'm going to finish today's talk with just discussing some herbs and spices. And there's a lot of information out there on herbs and spices that can help with blood sugar control. But I just wanted to mention 3 here that have some pretty good effects, and they have studies behind them. So for example, cinnamon for prediabetes, 250 milligrams of cinnamon extract per day, and in particular the Ceylon cinnamon before meals, so before breakfast and dinner, and they showed an 8.4% decrease in that fasting blood glucose. So that helps, the cinnamon helps those cells better respond to insulin. And then probiotics for type 2 diabetes, taken for 2 months had a 16-point drop in fasting blood glucose and a 0.53% drop in A1C. So if you think about A1C, it is measured as a percentage. So what this would indicate is that if you have a A1C of 7, that could drop it to about 6.5, a little slightly below there. You want to, when you're considering that probiotic, you want to make sure it has multiple species per capsule, and that that will also work at decreasing inflammation and destruction of pancreatic cells in the body. So that's how that probiotic works in your system. Chromium is another great mineral that you can add to the diet. So 200 micrograms per day may help reduce that A1C again by about 0.6%. So if you're at 6.5 and you're taking the chromium, you may get it down to closer to 6. So it helps also drop that fasting blood glucose by about 21 points in this study. So it enhances the effects of insulin and the cells that produce insulin. So if you're taking antacids or heartburn drugs, this may not be a strategy for you because that will interfere with that chromium absorption. So that's all I have for today. This week we will also be talking about how to include healthy fats in your diet. And next week we'll have a video on reducing inflammation in your body. So thanks for joining, and I will talk to you again soon.